Good evening, I'm Scott Hennessy.
And I'm Beth Farnsworth. Welcome to Be Mindful, a show dedicated to mental health resources. Ketamine therapy is a new option for hard-to-treat pain. It is becoming a billion-dollar industry, but there are questions surrounding the use of this medical anesthetic outside hospitals.
News Channel reporter Patricia Martellotti checks in with several psychiatrists, along with a patient who shares her experience after undergoing this treatment.
For years, Danny Martinelli of Carpinteria would wake up feeling broken.
Just being in a really low depressive state to the point where I couldn't work, I was losing relationships, financial gains, and it was the first time in my life that I actually felt mentally ill.
Martinelli experienced depression for as long as she could remember.
It had been part of my story for basically my whole life. Wasn't new to anxiety, but I've always been able to utilize tools to manage.
Like many, the Carpinteria resident turned to Western medication for depression.
Then additional mood stabilizers since I was 28, and just with, from the physician psychiatrist, just with the knowing that I would be on them for the rest of my life, and it just wasn't working.
After exhausting all familiar options, Martinelli turned to a decades-old surgical drug known as ketamine.
Ketamine is a legal medicine that has been used in the hospitals since the 70s, but at the right dose, it creates a very powerful experience in the conscious state.
While ketamine is not FDA approved for the treatment of any psychiatric disorder, prescriptions for the drug have soared as a treatment for pain, depression, anxiety, and other conditions.
It's right now a $3.1 billion market that's expected to grow to $6.9 billion in 2030, growing at a rate of more than 10% compounded annually.
Doctors at local ketamine therapy businesses, including Elevate Her Psychiatry and Lucid Therapeutics, say the number of clients asking for the treatment is skyrocketing.
We've probably tripled in our volume in the past year. We've hired many more staff. And that's why we expanded into this space where we have 5 treatment rooms.
Doctors at Lucid Therapeutics hope more people will learn about the impacts of ketamine therapy.
I was an ER doctor for 15 years, and I transitioned into this because I saw that there was very little resources for people in mental health. And when I saw how effective this was, it was undeniable.
But doctors also warn ketamine therapy is not for everyone, and there are questions raised over this trending method. According to the FDA, safety concerns include risks of sedation, increases in blood pressure, and respiratory depression.
My hope is that people who are seeking for this type of therapy be ready, do their research, and also practitioners who are doing this be more mindful. PTSD in particular, and it needs extra care. What does that aftercare look like?
While the FDA warns patients and healthcare providers about potential risks with compound ketamine products, Martinelli believes its impact has affected her life for the better.
I wake up feeling hopeful for the day and that sense of joy. I'm living, I'm networking, I'm getting out there.
In Santa Barbara, I'm News Channel reporter Patricia Martellotti.
And we want to remind everyone, while local businesses are thriving on ketamine therapy, it is currently not FDA approved for the treatment of any psychiatric disorder.